Jack Turman Jr. I'm a professor in the Department of Social and Behavioral Sciences at the Indiana University Fairbanks School of Public Health, and a professor in the School of Medicine, and the founder and director of the Grassroots Maternal and Child Health Initiative. When we think about the issue of persistently high infant mortality rates, all of us in global and maternal and child health know that we need an increased focus on the inequitable social and economic and cultural systems that we know are at the root cause of infant mortality. When you look at states that have persistently high infant mortality rates like Indiana, two issues stand out. One is that we continue to see large racial disparities in birth outcomes. Our African-American neighbors and families across the socioeconomic and maternal education spectrum are disproportionately impacted by this tragedy. Second, we see that there is a continued focus on healthcare without an equal focus on addressing inequitable social and economic causes that lie at the heart of infant mortality. And we know that these causes are disproportionately found in minority communities and in poor rural communities. In our research, which is termed the Grassroots Maternal and Child Health Initiative, we believe that the best way to address these problems is to understand the social systems that are lying at the heart in these communities. And the best way to do this, as we say, is ask the women who reside in these places. These women are the community experts, and they have great insight into the causes of social problems in their communities and the solution strategies needed to address them. To that end, we developed the Grassroots Maternal and Child Health Leadership Training Program. Our goals are to create systems that prevent marginalized women from experiencing social conditions that can lead to medical problems that then result in poor birth outcomes. Two groups highlighted in our work are mothers in the justice system and mothers that are experiencing housing instability. To this end, we have partnered with Grassroots Maternal and Child Health leaders to serve these cohorts of women. For mothers in the justice system, we created Mothers on the Rise, which is an individualized, coordinated system of care for mother-baby pairs who are transitioning from the Leith unit of the Indiana Women's Prison to their home community. We have not seen any infant mortality in our cohort of 23 women. No woman has returned to the justice system, and no mother-baby pair has been separated. For those mothers experiencing housing instability, we were just awarded $2.4 million from HRSA to implement two interventions in Indianapolis to serve this cohort of women. We will be implementing the Healthy Beginnings at Home intervention, which provides housing navigation, rental assistance, and comprehensive case management services for pregnant women throughout their pregnancy and the first 2 years of their baby's lives. We also complement this intervention with a health justice intervention to bring about changes in laws and policies and judicial actions centered around the eviction of pregnant women and women parenting infants. Go out into marginalized communities and learn and listen from the women there. They have very valuable perspectives to provide, and work alongside them to bring about lasting social changes. Remember, we need to invite them to the table to devise the best and feasible solution strategies. Second, if you want to help initiate social change, start small and focused. For instance, reach out to a local affordable housing community and learn what types of supports the mothers, babies, and families need there, whether it be clothing or food or after-school tutoring or job skill enhancement, or just a friend to sit down and talk to and have a cup of tea or coffee with. All those things are very important in starting that social change. Volunteer in a daycare or church in these communities. They carry a lot of burden of serving these families and are always in need of help to lift these families up and support these families. Most importantly, moving forward in your community, do not judge women for their birth outcomes. Meet them where they're at And most importantly, always treat them with great dignity, honor, and respect. That goes a long way to helping this problem.